Alexander. He's in Westminster for us now. Very good afternoon to you.
Good afternoon.
Danny Alexander, I don't know whether you heard Stephanie Flanders there saying that, frankly, what you've done is you're raising revenues by 17 billion, spending 17 billion. What happens to the deficit?
What happens to the deficit is that we have set out, in addition to the tax switch, which Stephanie rightly said, the figures on that do add up and it would benefit a lot of people with an extra £700 in their pocket every year. In addition to that tax switch, we've also set out £15 billion worth of additional spending cuts that we would make. Over 10 billion of that would go towards reducing the deficit. 5 billion would be used to spend on additional spending commitments that we want to make, particularly in the field of education and in terms of creating jobs. So we've gone much further, both on tax and on spending cuts, in terms of how we would both ensure that the country becomes fairer and meet the black hole in the public finances.
You made a great play at your news conference this morning about this was the elephant in the room that the Labour and Conservatives didn't want to talk about. But there is still a massive gap in what needs to be cut, and we still don't know the detail of what you would do then.
Well, if you look in the tables in our manifesto, we're the only party that's attached full costings to our manifesto. As Stephanie rightly said, that will invite scrutiny. We'd welcome that scrutiny because there are over £15 billion of cuts. Things like scrapping the Child Trust Fund, stopping paying tax credits to higher earners, ending the bureaucratic oversight of local government from central government and the huge waste that implies, scrapping ID cards, scrapping biometric passports. I could go on. There's a list of 20-odd things
in our manifesto.
Let me interrupt you
and let me put one to you. Page 41 of your manifesto, you talk about helping people with mental health problems. You would roll out cognitive and behavioural therapies. It sounds fine. You look at your chart at the back of the manifesto. It says that it's going to save you £425 million in year 2, 500 in year 3, 575 million in year 4. How?
Well, that's actually based on the government's own projections. Lord Layard set out a programme for training more cognitive behavioural therapists to ensure that people who do suffer with mental health problems such as depression can get help to get them back into work quickly. The government's own regulatory impact assessment showed those benefits. Unaccountably, the government is stopping spending on this in 2011. We want to carry on so that those benefits in terms of lower benefit bills, more tax revenue for people in work can go forward. In terms of how we pay for it, we're making savings within the NHS budget. Things like scrapping
briefly, Mr. Alexander, you talk about anti-avoidance measures, which add up to over, I think, £4.5 billion. If it was really that easy to deal with that loophole, don't you think the government would have already done it?
Well, I wish they had, but the fact is that the Treasury estimates that the country loses up to £40 billion a year in tax avoidance. We're being very modest, therefore, in how much additional we think we can save through a general rule that says tax avoidance is wrong, through ending the practice of large companies owning their buildings offshore and so not paying full stamp duty when they sell them. There's a lot more that could be done on anti-avoidance. I think our modest proposals there could easily yield the £4.5 billion that we attach to them and help us to pay for putting money back into the pockets of people on low and middle incomes, a £700 a year tax break for people who are struggling in this recession. That's what we mean by fairness.
All right, Danny Alexander, thank you so much for being with us. Thank you. Now, Gordon Brown has admitted that he should have been tougher on the banks when he was Chancellor. He said this morning that there should have been more regulation of the